How you doing, guys? This is Firefighter Olson from 75C. Just want to show you some pretty cool things we've been changing around on ImageTrend. More importantly, the power tools. Chief Pownell, myself, and Firefighter Hargreaves have been messing around with. Just to give you a quick history, we bought ImageTrend like 2 years ago. Chief Pownell was basically made this run form and all the information that he wants us to enter. He was one of the first. We were one of the first departments to use ImageTrend Elite. So when it came out, we were limited to what we had and what tools we had to use. Since then, they've made some updates, and we're trying to catch up to it now. A lot of departments are switching to this new ImageTrend Elite. They use the old ImageTrend, I guess, Field or Field Bridge or whatnot. So they're all switching over to this new one, and we're trying to. They're coming out with a lot of new things that will be able to make your job a lot easier. The reason for these power tools, like you guys know, with the assessment tab, we already have that one out. It makes data entry a lot easier and a lot smoother for you guys in the field. Less time on the computer is always a good thing. Documenting is not everyone's favorite, so we're here to try and make it easier for you guys. One of the issues, I just want that we came up with, and what came up in QA and with Dr. Mack, mainly Dr. Mack, is he's not a big fan of this assessment tab. We have it now, and he's not a big fan of this all normal. When you click all normal, it says that you assessed every knuckle, thumb, forearm, and elbow as normal for the patient and no injuries, and you thoroughly assessed it. We all know that is not always the case. So this all normal, Dr. Mack has a big issue with, because the printout he gets, it shows that if we click all normal, which most of us do, that we did check all this stuff and all of it was in good working order. So he came to us and said, I don't like this, let's change it. So what we did, we're going to be moving away from this. I'll probably be taking down in a week or so this assessment power tool, and we're going to be replacing it with the exam tool. We just want you guys to have data or quicker data entry, less time on the computer doing reports, and a more truthful exam. That's all it is. This new exam tab, all it is going to populate the assessment tab under activity. So we'll get to that in a minute. It looks the same. You put in your name, put in the time. This is a blank run form, so I don't have on scene or patient contact times. So we'll just put current. What some of the categories on here, they're similar to what was on the assessment tab, but not. That one had a lot of things to select from. This one's a little less detailed. If for our ANO ×4, GCS of 15 patient, which is, I don't know, 80 to 90% of the people we run. So we have a mental status exam. I have defaulted these to oriented ×4 and normal baseline for patient. So that's why those are set already in blue, because 80 to 90% of our patients are that. It is you guys' responsibility to go in here, if it's different, to unclick these or to say what they are, different than ANO ×4 and GCS 15. So there's your confused, combative, all that good stuff. And these less and more tabs are what expand and contract this. You can search that. Other things that we've set to default. Skin. You're going to check a radial. You're looking at the patient. You can see that it's dry. You can feel that it's warm and that it's normal for that patient. If anything deviates from that, just like we said, you can search it. You can open it up, just like the assessment tab had skin section. This one has the same thing, and different options for you to pick from. Neuro. We're going to do a neuro on all our patients. Does all their extremities moving? PMS. That's all it really is. We've defaulted it for normal baseline for patient. There's the rest. So if you're getting into a stroke or whatnot, all that's there. But we defaulted it for normal because that's, like we said, a lot of our patients. You're looking at the patient, so you can see that their head doesn't have any of these items. So that's why we defaulted it to normal. We're trying to help you guys not click as much and not, be on the computer as much. Face, you looked at their face, didn't see any injuries, it's normal. If you anything else, there it is. Not every patient are we doing a pupil exam. If you need to do a pupil exam, you open it up, whip out the light out of the bulb, and there's your pearl. If you checked pupils on a stroke or head injury or drug overdose, anything like that, there's your pupils, and here are all your different things that you can select from. They're all there. If I showed them all there, the scroll on this screen would be really long, so that's why we got away from that. If you need to delete the eye exam, here's your X. So any of these things you want to delete that you added, you can delete, so it goes right away. The neck, you were looking at them, they had a normal neck. Chest and lung assessment, we left it blank for now. We're not checking if there was a equal chest rise and fall. I probably would have selected that as normal or as the default because you can see that. We're not checking lung sounds on every patient, so I didn't want to select breath sounds equal. So I just kind of left this blank. All your shortness of breath, your chest pains, your traumas, whatnot. You're checking lung sounds. So go in here and say what it is. If you need to search for Strider, there it is. You can search in that tab, or you can go to the alphabetical S, more Strider. We just tried to keep it compact, this vertically, so this the scroll for most of your patients scrolling down isn't going to be super long. Pelvis, most of us are not doing a pelvis exam on most of our patients, so I clicked not done. Any trauma or any bleeding out of these areas are clickable. Just click the more. Just click more, and they'll all be there just like it was in assessment. To get away what Dr. Mack was saying with the knuckles and hands and elbows, and here's where you add it. It's not going to say you did it unless you add it. So if you have abdominal pain, add your abdominal pain, what it was, general, upper, left, right, all the quadrants are there, and all the same selectables are there if you need to select it. Let me just go show something for more of like a trauma call for your extremities. Say you need to pick 2 extremities out of these options. They're all there. Yep, that's pretty ridiculous, but they're all there. Your left ankle has a laceration. So there's how you're going to select that. You can write how long it is, how deep, if it's bleeding or not. If you need to add another extremity, so say the upper right arm also had an issue or something you needed to document. You thoroughly examined it or examined it. You can't click right arm here and document something differently. So this is just for the left ankle. If you need another body part or another extremity, add it, scroll down, upper right arm, had a lac, and what size if you want to throw that in there too. So that's how you add multiple body parts. The first one's up here, you scroll down, there's the second one. Any trauma, here's your spine. You're not checking, feeling the spine on everyone. If you did it for a trauma or whatnot, there it is. There's the area of the spine, general, or you can be more specific, and there's all your options. We wanted this to be less clicking. I was just, showing you everything. I'll leave some of this so we'll see how it documents. Once you're done, click OK, just like you did on assessment. It will populate your activities and assessment. If you want to go in and look at it, we didn't just click OK. Oh, there, I went by it on accident. So here's everything you did, just like our assessment power tool used to populate this. The exam power tool now populates this a little quicker, a little more truthful. If you didn't do lungs and pelvis, it's not going to say you did it. So it's a good thing, and Dr. Mack will like it. If you didn't do the abdominal or eye, it's not going to say you did it, so you're not going to be fibbing on the report. So that's the assessment tab. That was how it all started. Dr. Mack, like we said, had a big issue with this one and how it was overly documenting. The assessment tab will hopefully solve that for you guys. Assessment power tool. A few other things that we've added. We used to have the IV power tool back when we started. The issue was when you did the IV, entered the information on this power tool, it would populate the procedure and med, but these would still be red. with the validation score thing, and you'd have to click this now and go in and answer a few more questions. So it didn't make sense to use the power tool. We want it to make sense to use the power tool for speed and efficiency for you guys, just to make your life easier. So for IV, so you want to start an IV. I'll do it just like we always do. Put in the time. I'll just put current. Was it done prior to arrival? No. And I've pre-selected these to be only IV treatment. So you got IV start in the extremity, your IO, and your EJ. Let's just practice with one and see how it documents. I did an 18, and I even ordered these in the most frequent to least frequent. So all your ACs are here. I'll probably move those to the end. Sorry about that, but in your foot. But your ACs are there. How many times you attempted? Was it successful? Did anything change? It's defaulted to no for prior to arrival. I'm actually going to probably delete this because it says it there. And you did a flush, 10 cc flush. Document that. If you hung a bag, you're clicking that and how much you got into them. And here's all your milliliters. Did you KVO? How many, all the different document amounts are there. Response to the med, we'll just go unchanged. So I filled in all my blanks. Hit OK. Voila. They're both done, not read, and thoroughly documented. You're not having to do the procedure as an IV. Hit OK, and then come back and do your medication as your normal saline flush or whatnot. It does it all for you in one power tool. So that's the beauty of it. Hopefully it makes everything a little more smooth for you. That was IV. Same with procedures. For procedures, we've made the favorites, the most frequent things done, I guess you could say. Just add your crew, your date. Was it done prior to arrival? I've just defaulted it to no because that's most of the time. Attempt successful. Was an adult. C-collar. Was it, all that good stuff. Did you intubate? And that's the size of the tube. How'd they change? And the complication, most of the time it's none. If it isn't, there you go to change it. So that'll say, let's just practice. You did a 4 lead. Obviously 1 attempt. It was successful. Not size of equipment. Unchanged and no procedure complication. Make sure you have your name up here for who did it. Current time and OK. And it's there. It's done that you documented or that you performed a 4 lead. If you did a glucose, that's under procedures. All the same procedures as you guys have done before, except IV. IV's under your power tool because it's going to put in your procedure and your med all in one power tool. Another power tool we've added is, obviously medications. Vitals is going to look different, but it could be pretty good, I guess you could say. Crew member, time, put that in. It wasn't done prior to arrival. Some of these are going to be a little more detailed. And some of them would be defaulted to like sitting. Most people we find sitting. But the goal of adding patient position is when we go to the SOAP narrative and it says we arrived under O, we arrived on scene and found period. You know how that is now. Eventually, when ImageTrend IT catches up and fixes the SOAP narrative, we'll be able to pull how we found the position when we showed, or the patient when we showed up. So that's why I'm just, we're putting it in here now so you guys get into the habit of it. When the SOAP narrative catches up, it'll automatically pull all this into your SOAP narrative and look good. So we found him sitting, a rate of 80. It was regular. Respirations were normal. You can find normal, I think, on here. I'll make sure it adds to the favorites. Pressure was good. I'm just hitting tab, so this is super easy to document. Oh, come on. 80. There we go. We took it with the cuff, just like we have to answer now. Pulse ox, 99. We've added, oh, don't scroll. My mouse is not the program, it's me. Pulse ox, I've added a qualifier to what were they on when we measured this pulse ox. I defaulted it to room air, so everyone, most of the patients are room air. We did the 4-lead, they're a normal sinus. There's your pain scale if you want to enter that. There's your glucose. There's your GCS. All defaulted to 15 because that's 80 to 90% of our people. If it's something different, it's your responsibility to change it. I've also added stroke. Eventually this will open up a different stroke power tool, but yes or no. And I've defaulted, the county has their thermometers, so there's a temperature thing and it's tympanic. It's defaulted to that. If I hit OK, the vitals are in here. Everything's populated exactly how you want it. If you entered the ABPU, that'll be on there too. Anything, let me go over meds. I put the most frequent under favorites: so oxygen, albuterol, Atrovent, aspirin, nitro, and D50. Those are probably the ones we use the most, especially oxygen. There's your dose. You defaulted the favorites, the most frequent, so we give oxygen the most. There's your liters per minute for the unit, and so on. How we gave it, there's your IVIO, nasal cannula, all that stuff's there. If you need to see them all, click more. There's the site, if based on what IV site you used, if you have multiple. There's your response, and usually, like we said, no complications usually, so I defaulted it to none. So that's medications. The goal of this, like we said, is to make entering this information, which has to be here, a little more quick for you guys, so you're not sitting at the computers all day. Another reason for adding some of these details to vitals is that when we go into the SOAP and click SOAP and generate, eventually when ImageTrend IT catches up, we'll be able to customize what we want to select out of this into the SOAP narrative. So like it says now, patient has a history of C below. I don't know if you guys know that under the S, it just says that. We're going to be able to pick and list the things that you put under history right there that you found out or were told to you on scene. Same with vitals, how you found the patient, that's going to be under O. And same with assessment. You documented all this stuff under the exam tab and it put it into assessment. All that stuff should fall under your O in the SOAP because that's what you saw and examined. So it's coming. Be patient. That's all on ImageTrend side. What else do we need to talk about? 902s. It's coming where you can do your 902 from your EMS report. You won't have to find both on your CAD and download times. You'll be able to do both. It'll be a link right here to a quick EMS 902. It'll automatically link. It'll have like a chain link little icon here where both but the reports will be linked together. You'll click it, open the 902, pick, I don't know, the building type, and maybe like 2 or 3 other clicks, and it'll be done. The 902 will be done through your EMS report. You're welcome. Other things that are coming in the works, LifePack 15s, downloading your 12 leads and code summaries and all that jazz into this report. It's right up here. It's coming. Maybe in the summer we'll be doing that. It's not going to be for every call. We'll do them for cardiac and STEMI alerts, intubations and cardiac arrests, and electrical therapy. It'll be able to pull all the vitals from the code. You won't have to put in all your vitals. It'll pull all the 12 leads. It'll document the procedures being done. It'll do entitle CO2. It's coming. It'll make your job a lot easier. I don't want to make this video too long. I know you got stuff to do, of course. So that is the gist of Power Tools. We'll be removing assessment, and we'll be tweaking some of maybe the airway confirmation eventually. But use them if you want to. They're a lot easier than going into activities and documenting. But it's up to you. And in the future, we're going to tablets eventually. So the use of these will be a lot easier with the touch screens with the tablets. That's coming down the road. I think that's about it. You guys have a good afternoon. If you have any questions, give Chief Palnow, myself at 75C, or I believe Justin Hargraves will be able to help you with. He helped a lot on some of these. So give him a call as well. Have a good day. We'll talk to you later.